So I think probably the first thing to say is that a third of children in Wales are affected by poverty, and we've actually got approximately 15% of children in Wales living in severe poverty, which is the highest proportion in any of the UK jurisdictions. Now, that's about 200,000 children currently. Children and families have also been facing rising costs, not matched by incomes, recently, and I think we've got quite interesting figures in Wales which show that it's our employed family poverty. So it's not just people who are unemployed, it's people who are employed. We've got some of the lowest incomes in working families compared to the other jurisdictions. So we know we've had information this morning and a lot of the research detail explaining how poverty and deprivation are major risk factors for mental health problems in children. There's a number, I won't go through these, but the Minister referred to it in the opening, and the Public Health Wales speaker mentioned there are a number of strategies in Wales to address mental health, to address child poverty. And one thing that we're very clear about is that if you address poverty, we will increase the level of mental health difficulties and problems and disorders in children and young people by quite a significant percent. Children are nearly 3 times as likely to suffer mental health problems than their more affluent peers. You've had information about the fact that it affects family functioning, mostly through stress. There's a negative impact on a child's sense of well-being, self-esteem. Some of the very poor children are likely to be so socially isolated. And young people who are not in education, employment or training, more of them come from socially disadvantaged households, and I'll refer to that later. Alcohol and smoking and substance misuse are more common in children in deprived populations, and these are also major risk factors for mental health problems. I won't go into the research of that, but we know there's increased anxiety, depression, and for substance misuse, psychosis in some vulnerable groups. In Wales, we've got the second highest rate in the UK of 15-year-olds reporting recent cannabis use. So it's about 12% of girls and 12% of boys and 11% of girls. 12% of our girls in Wales, aged 13, are reporting smoking weekly, which is 2 times the UK national average. And also in Wales, we've got the highest rate of weekly alcohol use by 13-year-olds compared to the rest of the UK. So 23% of our boys and 20% of our girls, aged 13, are reporting weekly alcohol use. And all these things, that's both linked to the high deprived areas and to mental health problems. So we have to think about all these factors. There was a thematic review of child deaths by probable suicide, which was completed this year. And some of the factors identified in that piece of work, again, linked to low economic conditions. So low socio-economic status. Again, young people who are not in education, employment or training, which again, there's a link there with those young people who are in poverty. And those young people with mental health disorders and drugs and alcohol. So it's just pulling together some of these things which we know are high risk factors for our young people. And in 2011, as was reported this morning, the suicide rate for our 15 plus young people aged 15 years and over was again the highest across the UK jurisdiction. So these are all factors that we need to take into account. Just got some figures here on the prevalence of mental health problems. I won't go into a lot of the detail, but we know that about 10% of our 5 to 16-year-olds have a diagnosable mental disorder. We certainly don't see them all. And then I've got a breakdown, again, the slides will be available, of some of the different percentages for depression, anxiety and conduct disorder. I think it's important to note that children with a significant learning disability have 6 times the likelihood of having a mental disorder. Teenage mothers, which relates to the previous slide, 3 times the rate of postnatal depression, and a higher risk of poor mental health 3 years post-birth. Now that's if you're a teenage mother. When you think about the number of teenage mothers that are coming from high deprivation, and again you're multiplying your risk factors. 45% have looked after children. 95% of our imprisoned young offenders have a mental disorder. A day a week, I work with the All Wales Forensic Adolescent Team, where we see the most complex young people who've got involved in youth justice and also have severe mental disorder. And these young people have an incredible array of very complex difficulties, but massive, usually massive socioeconomic problems as well. So, and we know that more than 50% of all adults with mental disorder had a diagnosis of some sort in childhood around mental health problems. So just a brief overview of what we would expect to be seeing in CAMHS. We see some of the emerging serious mental illness, but also the emotional and behavioural disorders, and some of those results of abuse or neglect, and some of those issues that link in with those other factors that impact in low, where young people are living in economically deprived situations. So CAMHS, Child Adolescent Mental Health Services, what really are we expecting to do? It's a little different from the adult mental health service provision, and it's something that we're trying very much to hold on to in children's services, because the children are not sort of mini adults with, mini situations of what adults are in. So for CAMHS, we should really, I suppose it's a personal view, be working with children and young people in difficult circumstances. Actually, it's more than a personal view. This is actually how we expect to organise our services. Those at risk of mental disorder, and we can identify them, that linked a bit, with our earlier discussion. Those clearly who have a diagnosable disorder, and those with a high level of functional impairment which is related to mental health difficulties, but which might not meet sort of a diagnosis as you might expect in adult mental health. So that would certainly fit some of our young people involved with youth offending teams, some of the looked after children, a lot of the young people who are in deprived circumstances and involved with substance misuse and risk-taking behaviour.